Let's continue getting responses on education and schooling and other things. We're joined now by Gugu, South Africa's Director of Program from Save the Children. A very good evening to you, and thank you so much for joining us, Ms. Xaba. So, as I was saying to Bishop Zondi earlier on, that you have made a call that children need to be looked after during this time, especially as you know, there is so much going on. Children are rendered vulnerable, although they are already vulnerable. And we heard the president, actually Bishop Zondi, saying many of the people who are in these community halls are children. What have you gleaned from either the people on the ground or the collaborations that you're having?
Thank you very much, Tapiso, for giving Save the Children South Africa the opportunity to come in. And we are happy that the president has put up a good plan in order for us to respond and rescue and even support the people in KZN. I also note that child safeguarding needs to be known by everybody in South Africa, because the questionnaires posed to the bishop indicated that there is not much that is known about it. For instance, the fact that children have been placed in these safe homes, it basically means the parents that could take care of them, some of them are not there. And then some that have parents, their parents are stressed because of the situation that they've gone through. So then it means we need responsible adults that are taking care of a certain group of children in order to make sure that they are safe from predators that could be in that particular shelter, or also supporting the parents, because right now the parents need psychotherapy. They cannot do proper parenting. So it means, as government, health department, social department, and education need to provide this kind of support to the parents, so that we further protect our children. Even though we give them food, we give them water and shelter and maybe blankets and clothes, it's important to continue protecting them, because as you have also indicated, they have gone through trauma. They may be injured, they may be emotionally injured, so there's need for us to provide all that kind of support
and
to both parents and children.
It's even more so for a young mind to process this. When we as adults are sitting here watching while we are, commiserating with the people of KwaZulu-Natal going through somewhat we've never seen in our lives before, for a young mind it must be even more difficult. What have you heard in terms of what children are facing? I'd imagine that some of them are even separated from family, from people that they know, because of the floods sweeping people from one end to the other, homes collapsing, children being buried under the rubble. Talk to us through some of what you've heard about in KwaZulu-Natal.
Okay. Save the Children actually works in the field, more so in eThekwini, with what we call child facilitators that have shared with us one list of people that have been affected, the households that have been affected, and we know the children that have reported missing parents, and some of them have been placed in shelters, some of them have been placed in neighbors that still have houses, and some have just been given to anybody that is willing to support, because there's a lot of support from the community members. So that means there's a lot of children that are displaced. The 270,000 that the president is mentioning, it's consisting of maybe 50% of some of these children in the schools that are damaged, that are not going to be able to access schools. So again, we know that children need to be supported with learning. We've got early childhood development children, which is the ages below 5, and children that are above 5 years and above, who need support in order to get some learning. You and I know that due to COVID, due to the strikes in KZN, we've lost a lot of time for learning. So it means we need to act timeously right now to ensure that some level of learning is happening in each of the places where children are. And I know that there's a lot of assessments that we are doing in order to find some of these children and be able to provide the support.
And you know, schools play such an important role socially. It's not only a place of learning, and as we know that, you know, there's school nutrition schemes that help parents who don't have the means to feed their children. It provides shelter for children when their parents are either at work or they just don't really have anywhere to go. So what more can be done? And I want you to also talk to us about the psychosocial services that the president said are needed. Because it's not that you just sit somebody down, and you can talk to me about the professional aspect of it, but to say, you've just had trauma, this is how we must deal with it. It's a very involved process, isn't it?
Thank you, Tsepiso, for the question. Yes, it's a very involved process. And maybe we should start at the point that South Africa right now doesn't have very strong psychosocial support services that is easily available and at a reasonable cost. So it means the health services that we have now and the human resource need to be maybe distributed to go into some of the shelters and some of the households. One, to assess the need. And then once the need has been assessed, it would be proper then to channel the children to the right professionals. And a lot of assessment needs to be done. A lot of time needs to be spent talking to the children so that you establish where exactly the child is at and what kind of support they would need. Because some of the children need somebody to listen to them. Some of the children need some kind of education in order for them to understand what is happening, because they don't understand what is happening and why are they going through this situation, and why is it that their parents are not there, or why is it that their parents are not able to give them the help that they need, and why is it that they cannot go to school and how they should be supported. So we need the collaboration you were talking about. We need health, social development, and education to come together and provide the help that is required.
Thank you so much.
So those are basically the things that need to be done to provide the integrated care.
All right. I really appreciate your time and insights. Ms. Gugu Xaba, South Africa's Director of Program from Save the Children.